Welcome back to Tampa Bay's Morning Blend. As we've been talking about health news here recently, a lot of the headlines, a lot of the attention has been on coronavirus and COVID-19, right? Well, this morning we want to focus on our heart health and why it is crucial that people are still making sure that they're going to those wellness visits. And we're about to hear an amazing survival story of a great survivor who's a local artist here. But first, let's meet this doctor who we can talk more on heart health. And this is Dr. Malor, cardiothoracic surgeon at AdventHealth. This is the world that he's been living in here for quite some time. But it's so important, doctors, we were chatting about before we got started this morning, that again, I know a lot of the attention is on COVID-19, but these checkups and making sure that we see our doctor about our heart is just so crucial right now, are they not?
Absolutely. And, it may be more so. We're seeing a lot of people who are a little bit nervous, a little bit scared to come into the hospital or come into the doctor's office, during this COVID crisis. And of course, that's very important. But we have seen information, one large study coming out of Europe, where we've seen about a 40% drop in admissions for heart attacks with about a 20% increase in mortality. So it's important to understand that there's other health factors, and your heart is one of them that is extremely important and something that you really need to focus on and take care of despite what's going on. And we have.
So let's talk about some of those factors. I shared, at the top of the show that my dad just had a massive heart attack in the beginning of the year. And I think it's important not only for people to know their own health risks, but to know the health risks of their loved ones too. And sometimes we can encourage one another in our families to make sure that they're going to those appointments and make sure that they know what's going on.
Absolutely. So, the health risks that we see mostly, anybody who smokes, high blood pressure, cholesterol, diabetes, and a big one that we're going to hit on later, I'm sure, with Gene's story, is a family history. And those sorts of things really should, key in to paying attention to your heart. The warning signs of chest pain, chest pressure, trouble breathing, all those things are very serious things, especially in light of those risk factors I mentioned, and should prompt you to be checked out. And these days, telemedicine is phenomenal, and just getting that check-in with your physician, even from the safety of your own home over a computer, can be done, and make sure that you're taking care of all your health problems.
We're going to hear from Gene in just a little bit, but talk about symptoms and kind of what we should be looking for, especially women versus men, because I feel like sometimes those messages do get a little mixed up and what you should be looking for and what should cause a red flag.
Yeah, so that's a big one. Women and men, you can, and mostly you do have the typical presentation where you have chest pressure, feels like an elephant sitting on your chest, people say. Pain, numbness down your left arm. Shortness of breath, sudden swelling in your legs, all those things are sort of classical for heart problems. Men tend to present with those more often. Women, on the other hand, are more likely to present with atypical symptoms. And we see a lot of people who have nausea, gastrointestinal upset, feelings of heartburn, obviously can feel very similar to heart pain, but get sort of blown off as something that's less serious and doesn't need to be checked out. But all those things, as you get older, it's clearly more common and more important. But even in a younger population, if you have those risk factors, all those sorts of things you should watch out for and alert your physician if you have those. If they're new, certainly, or if you get those GI symptoms, the nausea or worsening heartburn, those things should also trigger you and make you think, this is probably my GI symptoms, but this could be my heart and a serious problem, and I should have it checked out.
It's interesting. We have about a minute left here, and I think the good news is if you do find these symptoms early enough, there is treatment, and we're going to talk with Gene in just a moment, who had open heart surgery. But I know stents, I feel like a lot more people are getting stents as well, and last for many years. I mean, this is a good treatment option for people.
It certainly is. And the stents and what the cardiologists can do is getting better, seems like every year. They have a wide variety of new stents. They last longer, they work better, they're safer. And really, that's a great option if this can be caught early in patients who don't have as severe or widespread disease as our next guest is going to present with. But they can't fix everything. But if it's if it's caught early, you have a much better chance of being fixed with a stent than if it progresses to a more severe stage of heart disease.
Well, Dr. Malor, we're going to sit tight right here. We're going to toss to a commercial break. But after the break, we're going to hear from Gene, who had a heart attack earlier this year, but thankfully is doing well. And he has quite the story to share. In the meantime, though, there's the website for more information, floridaheartexperts.com, certainly from the experts there at AdventHealth. So stay right there with me, doctor, and we'll see you on the other side of the break.